Hi, welcome back. I am now going to let you know the ways that you can measure your various symbols of ovulation in your fertility cycle. As I mentioned in the previous video, you ovulating around the middle of your cycle. Oftentimes that is 12 to 16 days before you bleed. So for a woman with a longer cycle, it might be a little farther into the cycle than halfway. For a woman with a shorter cycle, it can be closer to menstruation. So it varies, and it's important to know these three things if you are trying to avoid pregnancy or become pregnant. They can be really helpful for either. Very critical, basically, for either. Because you can only become pregnant when you're fertile, which means when you're bleeding, unless you have an extremely short cycle, you can't become pregnant. Or right before you bleed, same thing. Very rarely will a woman ovulate twice in her cycle, but they're usually very close to the same time, like within a day. Rarely 2 days. But you can measure these things. So they are basal body temperature, cervical position, and cervical fluid. And the basal body temperature part is that every morning when you wake up, first thing, before you get out of bed, you grab your thermometer from your nightstand, put it in your mouth, and see what your temperature is. Chart that every single day. And when you ovulate, what happens after you ovulate is your temperature rises. So the morning after you ovulate, you'll know you've ovulated within 24 hours because your basal body temperature will rise. And when that occurs, you know you have ovulated, maybe in the middle of the night or the day before sometime. And that elevated temperature will remain until you menstruate again, which is great news. That information, knowing how long, how many days from ovulation until menstruation, is really critical if you're having difficulty becoming pregnant, because it might be you having a short phase. If it's less than 10 days, it's going to be almost impossible to get pregnant. But also, you can tell that if it's longer than 18 days, that's a positive pregnancy test. Your temperature alone can tell you if you are pregnant. If you have an elevated temperature after ovulation for 18 days or more, that's indicative of a pregnancy. Just so you know. The other thing you can measure is your cervical position. So this one might not be for everybody. You don't have to do it, but it is something that you should know, which is if you are in the bathroom or you're in your bedroom changing or whatnot, and you get into a sitting or squatting position, and you insert your finger, your middle finger, because it's the longest, into your vagina, and you put it all the way up in your vagina, you will notice that there's your cervix. If you've never felt it before, it's really fascinating to discover. And it is usually about the firmness of your nose. So touch your nose, just see how firm that is. That's about the same firmness as your cervix. And your cervix is rounder. It's like a donut with a little hole in the middle. So when you ovulate, what happens is if your vagina's, it varies. Some women have shorter vaginas than other women. But wherever your cervix is in your vagina, right when you ovulate, it pulls up higher. It comes up a little bit higher. So you have to reach further to find it. That's indicative of ovulation. And simultaneously, what happens when you ovulate is your os, which is the opening in your cervix, that is the canal, the doorway from your uterus to your vagina. It's the os and the cervix. It begins to dilate or open just a little bit. You might notice that a couple days before you ovulate, it starts to open, and when you ovulate, it's opened even more. If you've had children before, you'll notice it probably more than if you've never had children. But you can feel it like a dimple in the chin. It's, or like if you have dimples here, you can feel it with your finger. Same with on the cervix. You can feel a little dimple with your finger, and you can tell with some time and having done it for a while, you'll be able to notice when it's more open. And that will be open, for a couple days. It'll slowly open when you ovulate. It will be the most open, and then it will close up again quite quickly. and your cervix will drop back down again. So it's sort of, you know, it's something that you check maybe 2 or 3 times a day when you're nearing ovulation, just so that you know for sure when it's occurring, because it changes throughout the day. The third method is cervical fluid or cervical mucus. You'll notice this initially, probably you've noticed that when you wear underwear, you have like a sort of a fluid or a film or a mucus, a secretion, vaginal secretions, and that is coming from your cervix, which you just reached up and felt. It's firm as your nose. Inside the os, there are these glands that produce fluid, and these serve as they serve many purposes: to prevent infections, it's like a self-cleaning mechanism, so it just keeps everything going out instead of going in, which is fabulous. And when you have just bled, you have just menstruated, there's very little to none. So you'll notice it's very dry. Your panties stay nice and clean, or when you wipe, there might be a little bit of something, but if you touch it, it'll dry on your finger really quickly. As you near ovulation, there will be more of it. Your cervix will produce more, and it's thick, it's kind of pasty. It might be more like lotion as you get closer to ovulation. It might be like a rubber cement, sort of crumbly a little bit. And this fluid is coming out of the cervix, and it's like, in structure, it's like this crazy network of cells and things, and that makes it very, very difficult for any sperm to penetrate. And basically it's like your body's natural spermicide. Even if a sperm were to penetrate it, it could only live in that fluid or mucus for a couple hours, because it's just very hostile. It's not the right pH, and so really it's not hospitable for sperm. You can